Now at 10, an urgent warning one day before New Year's Eve as the Omicron variant surges in San Antonio. University Health says it's too late to stop the Christmas surge, but we can stop a New Year's pile-on. They put out a New Year's plea today urging immediate action. They're asking you to avoid crowds, and they want you to skip any parties or indoor gatherings. But the city's biggest New Year's Eve bash is still on. We saw the stage going up for the Celebrate SA event downtown. Hours before tomorrow's party, San Antonio's mayor and other leaders will hold a news conference about the Omicron surge. Metro Health reported more than 700 new COVID cases today. And since Monday, we've seen nearly 3,000 new infections. The director of a UT Health San Antonio lab that handles a large part of the COVID testing in Bexar County tweeted this. Yesterday, 31.5% of our clinical COVID tests were positive in our lab here in San Antonio. We have never had a time period with a positivity rate this high in previous surges. This surge is different. But help is on the way in the form of treatments. For that, let's bring in Eyewitness News reporter Matt Houston. Matt, there are two new pills, one from Pfizer, one from Merck.
Yeah, Sharon, just days after Texas ran out of one of its few working COVID-19 treatments, a new type has now arrived. Tonight, at least a dozen Walmart pharmacies around San Antonio say they're stocked with new COVID-19 antiviral pills. Infected patients will need a prescription to get the drug that Dr. Fred Campbell says arrived at a good time.
I am inclined to think that those pills will be used to treat the Omicron variant until we're certain that we have a new monoclonal antibody preparation.
San Antonio's infusion center at the Freeman is out of the only existing antibody treatment that stifles the Omicron variant. The other versions are still available, but they're becoming practically worthless.
The virus will mutate by changing those proteins so that the monoclonal antibody no longer recognizes them as foreign protein.
Texas is expected to get more of the working infusion in mid-January. Scientists are also trying to engineer new antibodies specifically for Omicron.
So important that people get vaccinated and get their third shot rather than thinking maybe they'll get a monoclonal or some other treatment.
The vaccine offers broader protections against COVID since it's not tailored to recognize a specific viral trait. If antibody treatment is a rifle, Campbell says, vaccines are a shotgun blast. The two new pills work a little differently from the antibody treatments you might have gotten at the Freeman behind me. The antivirals will try and shut down the virus from the inside, whereas antibody treatments tend to bond to the viral cells to try and prevent them from infecting or getting inside your cells. Pfizer's pill works a little bit better than Merck, but you may not be able to take one or the other. That's why it's important to talk to your doctor about your medical history before you're prescribed with these new antiviral treatments. I'm Matt Houston, KENS 5 Eyewitness News.